Welcome back to The Deep Dive, where we take your stack of research and distill it into the knowledge you can start using today. You came to us searching for that ultimate recovery shortcut, that tool that, minimizes downtime and maximizes performance, whether you're recovering from some crazy intense workout or just a week of being hunched over a desk.
And, very few recovery techniques are as famous or as counterintuitive as the contrast bath. It's this ancient practice that's now a total staple for elite athletes, combining the harsh reality of ice with the soothing comfort of heat.
Right. We've been immersed in a pretty deep stack of sources today. Everything from peer-reviewed evidence looking at the specific physiological mechanisms to targeted research on outcomes for high-performance athletes and even clinical guidelines for safety. And our mission for you today is to really cut through the noise. We want to answer that central question. Is the contrast bath a truly effective recovery tool, or is it just a powerful placebo?
We're going to give you the precise recipe for when and how to use this, and importantly, how to do it safely.
Okay, let's unpack this. What exactly is the prescribed protocol for this alternating hot-cold dance? Because I think a lot of people assume it's just, throwing a bag of ice into a bathtub.
Yeah, and it is so much more deliberate than that. A contrast bath is simply the intentional cyclical submersion of a body part, often a limb, but sometimes, the whole body up to the chest in alternating warm and then cold water. It's all about creating a specific, really dramatic shift in temperature.
Here's where it gets really interesting, because the sources are so specific about the recipe. This isn't just hot and cold. You need to hit these very narrow, evidence-based temperature ranges.
Absolutely. The research gives us clear parameters. For the warm phase, you need a temperature between 100 and 110 degrees Fahrenheit.
Which is what, 38 to 43 Celsius?
Exactly. And you stay in that warm water for the longer phase, typically 3 to 4 minutes. You need that time to let the system fully open up.
And then comes the shock.
The cold transition is abrupt and it's intense. That water needs to be between 55 and 65 degrees Fahrenheit, so about 13 to 18 Celsius.
Okay.
And critically, this phase is short, only 1 minute.
That 1 minute has to feel like an eternity.
It really does, and that difference in duration is key. You need that prolonged exposure to heat to get the blood vessels to open as wide as possible. And then that short, intense cold burst to get them to clamp down to tighten before you start the next cycle.
And this isn't a one-and-done thing. A standard session involves repeating this process, right?
Yeah.
Cycling back and forth.
Yep, 3 to 5 times. So your total time commitment is going to be somewhere in the range of, say, 20 to 30 minutes.
Okay, so there's also a strategy to how you finish the session, which I found fascinating. It depends on your goal.
It does. If you're targeting localized inflammation, maybe a swollen ankle or just some specific pain, you always want to end with the cold cycle.
Why is that?
Because that leaves the vessels constricted. It helps suppress that inflammatory response.
But what if you're just using this for general recovery, maybe to relax before bed after a late game or something?
Then you might strategically choose to finish with the warm water. That choice promotes a lingering feeling of relaxation, sustained vasodilation. Some people just find it better for winding down. So you can really customize the ending based on what your body or maybe your mind needs most.
So we have the recipe.
Yeah.
But is there a deeper physiological engine driving this, or am I just going to feel more relaxed? Oh, there's a specific engine. And it's the central mechanism that researchers always highlight, the vascular pumping effect.
A vascular pump.
Exactly. You're using these huge temperature shifts to mechanically manipulate your local blood flow.
Yeah.
That's the key insight.
Okay, so let's break that down step by step. What happens when you first get into the heat?
So the warm water causes rapid vasodilation. Think of your blood vessels as flexible pipes.
Okay.
When you expose them to heat, those pipes widen a lot. This brings a surge of warm, fresh, oxygenated blood and nutrients rushing into the tissues. It's all about facilitating repair. And then the cold acts like a plunger, just forcing everything out.
That's a perfect analogy. That immediate, intense cold causes dramatic vasoconstriction. The vessels tighten, they contract powerfully, and that squeezing action pushes or flushes the stagnant fluid and blood out of the area.
So by going back and forth, you're creating this mechanical pump. But what are we actually pumping out? Is it just lactic acid? Lactate clearance is always the headline, but it's more complex than that. You're pushing out a few things. Excess fluid that causes swelling, inflammatory mediators that build up after muscle damage.
And yes, metabolic byproducts. Yeah. The pumping action moves all this stagnant stuff into your central circulatory system where it can be processed way more efficiently.
So the result is better circulation, less swelling, more oxygen getting to the tissue.
Yeah.
Because you force the system to flush and refresh. That all sounds great in theory,
Yeah.
but does the science actually back it up? What does the research say about those physical outcomes versus, how an athlete just feels?
And this is where the deep dive gets really nuanced. The scientific findings on the exact measurable physiological mechanisms, they're still somewhat mixed.
Mixed how?
Well, researchers are still trying to pin down definitive proof that it's only this pump that's responsible. It's hard to isolate one single biomarker that changes dramatically every single time in every study.
Hold on. So if the objective measurable stuff is mixed, how do we know this isn't just a really elaborate and very cold placebo effect?
That is the critical question, and it really speaks to the power of this subjective experience. What the sources show time and time again is that the perceived recovery benefits are exceptionally high. We see research, including some really detailed stuff from 2024 and 2017, that shows significantly faster subjective recovery and less fatigue reported by athletes.
And for an elite competitor, that feeling of being ready to go again, that's everything. That quick turnaround is priceless.
It really is. They frequently report a quicker return of performance after doing contrast sessions. But it's not purely subjective. When researchers look closer at the objective measures, they do find specific advantages.
Like what? Like actual data on blood flow?
Exactly. We see evidence of enhanced intramuscular circulation, so improved blood flow and oxygen delivery inside the muscle tissue, which backs up the whole theory. And there was this one fascinating study on elite futsal players.
Oh yeah. What did they find?
It showed that contrast therapy might actually outperform simple active recovery, like a light walk or a gentle cycle in achieving more efficient lactate clearance.
Wow.
The body was physically clearing out that metabolic waste faster than if the athletes had just done a normal cool down. That is a concrete physiological win.
That futsal data is pretty compelling.
Yeah.
But if it's all about pumping fluids, its use must go way beyond sports, right?
Do the sources mention any clinical applications?
They do, and it's a really important point. They highlight its utility in managing chronic conditions. We see real clinical benefits in things like knee osteoarthritis. Really? How so?
Contrast therapy has been shown to reduce pain and improve mobility in those patients. It suggests that anti-inflammatory and circulatory boost helps manage symptoms in non-athletes too.
So it's not just a tool for peak performance, it's a therapeutic aid.
Exactly.
That's a huge perspective shift. But, okay, we're intentionally shocking the body with these extreme temperatures. Safety has to be the main focus here.
It is the most vital section, absolutely. Because you're manipulating the vascular system so drastically, there are definite risks. We have to heed the medical guidance.
So who should absolutely stay away from this?
The must-avoid list is strict. Anyone with an open wound or an active infection in the area has to avoid it completely.
That makes sense.
Also, anyone with exposed internal fixation like K-wires, that's an immediate red flag.
And what about people with underlying health conditions, like heart problems?
Yes. Individuals with pre-existing or uncontrolled cardiovascular conditions, especially high blood pressure, need to avoid this. The rapid shifts in temperature can cause some serious cardiovascular strain. It's just an unnecessary stress on the heart.
Okay. And we talked about sensation. Obviously, you can feel heat, you can get a burn, but what about the cold? Is there a specific risk of tissue damage from the cold if you can't feel it properly?
There is. A big one. Impaired sensation from something like peripheral neuropathy is a major contraindication. Without the ability to feel that intense cold or pain, you could stay in way too long.
Yeah.
And that extreme, prolonged vasoconstriction can lead to serious cold injury, nerve damage, even localized tissue death. So the takeaway is stick to the recipe. Stick rigidly to the times and temperatures we laid out. Don't be a hero, precisely. The line between therapy and causing damage is pretty thin. Use the 3 to 4 minutes warm, 1 minute cold cycle. Don't go below 55 degrees Fahrenheit.
So if we put it all together, when should you actually be using a contrast bath?
Strategically, as a targeted intervention. After a big competition, after a block of really intense training, or when you're dealing with acute soreness or swelling, it's for a rapid turnaround.
And this brings us to the final synthesis, I guess.
Yeah.
In my whole recovery plan, where does this tool actually fit?
It's the enhancement, not replacement role. That's the key. Contrast baths are amazing supplements. They're meant to enhance circulation and give you that psychological and physical feeling of a quicker bounce back.
But I bet a lot of athletes over-index on tools like this. They expect them to fix everything else. They absolutely do. And you cannot let them replace the foundations. A contrast bath gives you a boost, but it is not a substitute for the bedrock essentials. consistent quality sleep, good nutrition, proper hydration, managing your training load.
They're facilitators. They optimize a body that's already getting the fundamental care it needs. Fantastic.
So the key takeaways are crystal clear. You're cycling between 100 to 110 degrees Fahrenheit warm for 3 to 4 minutes, and that sharp shock of 55 to 65 degrees cold for just 1 minute. You're creating that vascular pumping effect to move metabolic waste and refresh the tissues. And even if the objective, measurable changes can be complex, the value of that perceived recovery is.
No.
It's just consistently proven.
And if we connect this to the bigger picture, given that those perceived recovery benefits are so consistent among elite athletes, people who are masters of their own physical and mental state, does the feeling of recovery, that psychological readiness to perform again, become the most important factor, maybe even more critical than the strictly measurable physiological effects? It's something for you to consider the next time you step into the cold.